How can recurrent laryngeal nerve monitoring help during thyroid surgery? Intraoperative nerve monitoring using endotracheal surface electrodes allows assessment of vocal cord function during dissection near the nerve. This may reduce injury risk and assist identification. What is the typical postoperative care after hemithyroidectomy? Most patients can be discharged home the same day after hemithyroidectomy. Analgesics and monitoring or treating hypocalcemia are priorities. Activity is reduced for 1 week before gradual return to normal. When is outpatient thyroid surgery appropriate? Outpatient thyroidectomy can be considered for healthy patients undergoing hemithyroidectomy or total thyroidectomy without extensive lymph node dissection, provided no complications arise perioperatively. How does thyroid storm present postoperatively? Thyroid storm may present after surgery with hyperpyrexia, tachycardia, delirium, vomiting, diarrhea, dehydration, and hypotension from excess thyroid hormone release. Aggressive medical treatment is needed. How is a postoperative hematoma diagnosed after thyroidectomy? Clinical signs include acute neck swelling, pain, dysphagia, and potentially stridor. Ultrasound or neck CT confirms the diagnosis and guides needle aspiration or return to the OR. What features increase difficulty during thyroid surgery? Difficulty can arise from large goiters, substernal extension, extensive lymphadenopathy, invasion into surrounding structures, adhesions from prior neck surgery or radiation, and tendency to bleed. How is hypoparathyroidism screened for prior to discharge post-thyroidectomy? Serum calcium levels are checked after total thyroidectomy prior to discharge. Symptoms of perioral numbness and tetany should prompt repeat testing even if initial calcium is normal. When would thyroid lobectomy be recommended over total thyroidectomy for a thyroid nodule? Lobectomy may be appropriate for small low-risk cancers like low-grade microcarcinomas in patients at higher surgical risk or with comorbidities where complications should be minimized. How is recurrent laryngeal nerve function tested intraoperatively? Nerve monitoring uses electrodes to stimulate the vagus nerve and record signal transduction during dissection. Direct visualization assesses function at the end of surgery before closure. What is the typical postoperative radioactive iodine treatment timeline after total thyroidectomy for differentiated thyroid cancer? Radioactive iodine ablation is typically given 6-12 weeks after total thyroidectomy once TSH levels rise, to allow residual thyroid tissue uptake. Concurrent levothyroxine is withdrawn temporarily. How is central neck dissection performed during thyroid cancer operations? Central compartment lymph nodes are resected en bloc between the carotid arteries from hyoid bone superiorly to a nominate vein inferiorly. Care is taken to avoid injury to vital structures. What does the American Thyroid Association recommend regarding prophylactic central lymph node dissection for papillary thyroid cancer? They advise that prophylactic central neck dissection may be considered for advanced primary tumors but should not be done routinely for small low-risk cancers. How does the presence of Hashimoto's thyroiditis impact surgical approach for a thyroid nodule? Coexisting Hashimoto's reduces malignancy risk. More conservative resection may be opted for indeterminate nodules with high titers to avoid risks of total thyroidectomy. What are the ATA guidelines for timing of calcium monitoring after total thyroidectomy? ATA recommends calcium screening within 6 hours of surgery, then again at 24 hours post-op. Extended monitoring is appropriate before hospital discharge. How does retrosternal goiter impact the surgical approach? Median sternotomy or lateral thoracotomy may be required for resection instead of the standard cervical approach for very large retrosternal goiters. When would rapid steroid administration be indicated before thyroid surgery? Steroids given preoperatively can reduce inflammation and vascularity, which facilitates surgery for extensive Graves' disease, large goiters, and substernal extension. What measures can reduce postoperative nausea and vomiting after thyroidectomy? Antiemetics, proper hydration, and avoiding opioid analgesics when possible help reduce PONV. Minimally invasive video-assisted techniques can also lower the risk. What recurrent laryngeal nerve monitoring technique has the highest sensitivity? Intraoperative continuous vagal nerve monitoring using endotracheal tube surface electrodes allows constant assessment during dissection and has very high sensitivity for identifying nerve injury. How soon after thyroid lobectomy can patients typically return to desk work? Most patients can return to light sedentary desk work within 1-2 days after lobectomy provided pain and fatigue are tolerable, with activity advanced as the incision heals over the first postoperative week. Where is the thyroid gland located? The thyroid gland is located in the anterior lower neck, extending laterally from the midline and sitting just inferior to the larynx and trachea. It is situated anterior to the pharynx and esophagus. What is the thyroid gland composed of? The thyroid gland is composed of 2 symmetrical lobes, a connecting thyroid isthmus, and occasionally small posterior lobes. The lobes are made up of thyroid follicles surrounded by a thin capsule. What are the key anatomical relationships of the thyroid gland? The thyroid gland sits against the anterior trachea just inferior to the cricoid cartilage. The recurrent laryngeal nerves run posteriorly along its lateral lobes. The parathyroid glands lie posteriorly. What suspensory ligaments help stabilize thyroid position? 2 key suspensory ligaments are the pretracheal fascia and the lateral thyroid ligaments Barry's ligaments, which attach the posterolateral thyroid to the cricoid and upper tracheal rings. What blood vessels supply the thyroid? The thyroid gland receives superior and inferior thyroid arterial branches off the external carotid and thyrocervical trunks respectively. The thyroid veins drain into the internal jugular veins. What is the thyroid capsule? The thyroid capsule is a thin membranous connective tissue layer that envelops the gland. It also extends septae inwardly to incompletely divide the thyroid parenchyma into microscopic lobules. What are parafollicular or C cells? Where are they located? Parafollicular C cells reside in the thyroid but do not produce thyroid hormones. They produce calcitonin and are scattered between follicles. Medullary thyroid cancer arises from C cells. How does the thyroid isthmus cross over the trachea? The thyroid isthmus overlays the 2nd to 4th tracheal cartilage rings. Alterations in isthmus size or position may cause tracheal compression symptoms. What is the pyramidal lobe of the thyroid gland? The pyramidal lobe is a small posterior protrusion of thyroid tissue from the upper part of the isthmus found in 50% of people. It represents a remnant from embryological thyroid descent. What nerves innervate the thyroid gland? The thyroid gland receives autonomic innervation from both superior and inferior cervical sympathetic ganglia, including vasomotor fibers critical for hormone secretion. What is the path of the recurrent laryngeal nerve relative to the thyroid? The recurrent laryngeal nerve tracks posteriorly along the lateral thyroid lobe in the tracheoesophageal groove, closely approximated to the posterior thyroid capsule. Where are the parathyroid glands located relative to the thyroid gland? Typically, there are 2 parathyroid glands located on each side, an inferior and superior pair, adjacent to the thyroid's posterior surface near the inferior and superior poles. Histologically, what makes up thyroid follicles? Thyroid follicles consist of a single layer of follicular cells surrounding a lumen containing colloid, the extracellular proteinaceous substance rich in thyroglobulin and thyroid hormones. What anatomical spaces surround the thyroid gland? Spaces include the pretracheal fascia anteriorly, carotid sheath laterally, retropharynx and esophagus posteriorly, and the prevertebral fascia posteriorly. What is the thyroglossal duct and what remnant may it leave? The thyroglossal duct forms during embryologic development as the thyroid descends from foramen cecum. Its persistence can lead to thyroglossal duct cysts along the tract. What important structures pass through the superior and inferior thyroid foramina? The superior thyroid artery and superior laryngeal nerve pass through the superior foramen. The inferior thyroid arteries and recurrent laryngeal nerve pass through the inferior foramen. What is the course of the superior thyroid artery relative to the external laryngeal nerve? The superior thyroid artery approaches the thyroid gland, passing closely posterior to the external laryngeal nerve, putting the nerve at risk during ligation. What are the terminal branches of the superior thyroid artery? The superior thyroid artery terminates by branching into the anterior and posterior superior thyroid arteries, which supply the thyroid gland. Where does the inferior thyroid artery arise from? The inferior thyroid artery arises from the thyrocervical trunk off the subclavian artery, then tracks upward behind the carotid sheath to the thyroid gland. Why do the recurrent laryngeal nerves have different paths on each side? On the right, it branches directly off the vagus nerve. On the left, it loops under the aortic arch, causing the asymmetrical paths. What is the embryologic origin of the thyroid gland? The thyroid gland arises from a median endodermal thickening in the floor of the pharynx, then descends to its position in the neck via the thyroglossal duct. What helpful mnemonic summarizes the anterior neck structures from superior to inferior? Sir Charles Bell, voice, air, food, great vessels, helps remember the structures inferior to the hyoid bone. Submandibular gland, carotid sheath, larynx, thyroid, cricoid, trachea, esophagus. What are the anterior jugular veins? The anterior jugular veins drain the anterior neck and larynx, then descend on each side of the midline to enter the internal jugular veins or subclavian veins. What strap muscles cover the anterior surface of the thyroid gland? The strap muscles sternohyoid, sternothyroid, and omohyoid overlay the anterior thyroid surface. The anterior jugular veins descend along their lateral margins. What fascial layers separate the thyroid gland from the carotid sheath laterally? The pretracheal fascia covers the thyroid anteriorly, while the carotid sheath, containing carotid arteries, jugular veins, and vagus nerves, abuts it laterally. What important lymph node group receives drainage from the thyroid? Lymph from the thyroid primarily drains to the pretracheal and paratracheal lymph nodes located in the anterior central compartment of the neck. What key muscle overlays the posterior surface of the thyroid gland? The esophagus abuts the thyroid gland posteriorly. Contraction of the posterior cricoridinoid during swallowing provides a key landmark for identifying the recurrent laryngeal nerve. What causes the thyroid gland to have an asymmetric lobular shape? The right thyroid lobe is often larger, extending superiorly over the isthmus and trachea. The left lobe extends superiorly only to the level of the isthmus. Where would an enlarged retrosternal goiter project into? As retrosternal goiters enlarge inferiorly, they project through the thoracic inlet into the anterior mediastinum, posterior to the sternum. Why is the thyroid gland very vascular? The thyroid receives a rich arterial supply to provide oxygen and iodine